Hello, my name is Dr. Sharon Stern. I am a board-certified anesthesiologist with the Ohio Anesthesia Group. This video and anesthesia brochure will discuss neuroaxial anesthesia. Your surgeon has requested this type of anesthetic for your procedure. A neuroaxial anesthetic is either a spinal or an epidural. We will also show you what to expect on the day of surgery. On your arrival to the facility, you will be taken to a pre-procedural area. There, you will meet a nurse who will review your medical history and then place an intravenous catheter or IV. The IV is a small plastic tube that allows for fluids and medicines to be given during your stay at the facility. Next, you will meet the members of your anesthesia care team. An anesthesiologist is a doctor of medicine or osteopathy that has special training in the perioperative management of the surgical patient. You also may meet additional providers, such as a certified anesthesiologist assistant, referred to as an AA, or a certified registered nurse anesthetist, or CRNA, who are part of your care team. A member of the anesthesia team will review your medical and surgical history. It's very important that you tell the anesthesia provider about any conditions, history, experiences, or concerns that you have had in the past. Then the provider will discuss the anesthetic options and order any necessary medicines prior to going to the operating room. The anesthesiologist will be responsible for your care until you are discharged either to home or transferred to your hospital room. Neuroaxial anesthesia works by the injection of local anesthetics, numbing medicines, near the nerves in your back. These medicines block the nerves from feeling pain and they relax the muscles, which allow the surgeon to work. The procedure can be performed in the holding area, outside of the operating room, in the operating room, or in the labor and delivery rooms. Before administration, a mild sedative may be given through your IV, and then you will be instructed to sit on the edge of the bed. If you are a pregnant or laboring woman, no such sedative will be given due to the risk to your baby. The provider will then use a cleansing solution on the area of skin where he or she will be placing the injection. A small amount of local anesthetic will be injected at the site to numb the overlying skin. Next, a needle will be advanced to the correct site. With a spinal, a one-time dose of medicine will be injected. In the case of an epidural, a small tube or a catheter will be placed. This tube will be used to inject medicines over a period of time to keep you comfortable. Your anesthesiologist will recommend which is best for you. After the medicines are injected, you will begin to feel a warm sensation followed by heaviness in the affected area. Once the operating room is ready for your procedure, you will be transported by a wheeled cart into the room, and you will be moved onto the operating room bed. After you are secure on the bed, several monitors will be applied to help monitor the anesthetic. These monitors include a blood pressure cuff, an electrocardiogram monitor, and a blood oxygen saturation monitor or pulse oximeter. Then an oxygen mask will be applied to provide extra oxygen to your lungs during the procedure. Medicines will also be administered through your IV to relax or even induce a twilight-like sleep during your procedure. If any other special monitors are required, they will then be placed. Your anesthesiologist will discuss them with you prior to your procedure. Of note, this is not a general anesthetic, and you may remember events from the operating room. You should not have any unpleasant sensations throughout your surgical procedure. We will monitor you continuously with one of the members of our anesthesia care team for your safety. After your procedure is finished, you will be transported to the recovery room. Upon arrival in the recovery room, We will reapply the monitors that you had on during the operation, and a recovery room nurse will assume your care. The anesthesiologist will have medicines available to treat pain, nausea, or any other treatments that you may require during your recovery from the anesthetic. The anesthesiologist will be available during this time to deal with any problems or difficulties you may have until you are either discharged home or taken to your hospital room. Every procedure, including an anesthetic, can have some complications. Some of the most common complaints after a neuroaxial anesthetic are nausea, headache, blood pressure changes, and discomfort at the injection site. Some events will depend on your underlying medical problems. Rarely seen complications such as nerve injury, bleeding, infection at the puncture site, which may necessitate further interventions. Paralysis and death do occur. Thankfully, the incidence of these major complications is extremely low. However, a number of health problems may increase the risk of complications such as smoking, lung disease, heart disease, kidney failure, diabetes, bleeding disorders, and obesity. It is important that you discuss your medical history with your anesthesiologist so that he or she can explain if you are at increased risk for a major complication. You will be provided with an anesthesia consent form that will review many of these rare complications. If you have any questions or concerns after you review the consent, please feel free to discuss them with your anesthesiologist prior to surgery. Also, if any questions arise after you are discharged, you can contact the anesthesia office and an anesthesiologist will return your call in a timely fashion.